If you've been told that you may need biologic treatment for your arthritis, it's completely normal to feel unsure or even worried. You may be wondering what these medications are, how they work, whether they are safe, and what to expect if you start them. In this video, I'm going to explain biologic injections in a clear and simple way so you can understand what they are, why we use them, and how we manage them safely. I'm Dr. Bhadauria, consultant rheumatologist at Pure Rheumatology, London. Let's start with the basics. Biologic medications are a type of treatment used in inflammatory conditions such as rheumatoid arthritis, psoriatic arthritis, and other autoimmune diseases. Unlike traditional medications like methotrexate, which work more broadly on the immune system, biologics are targeted therapies. They are designed to block specific parts of the immune system that drive inflammation. For example, some biologics block a molecule called tumor necrosis factor, often shortened to TNF, which plays a key role in inflammation. By targeting these pathways, biologics can be very effective at reducing inflammation, controlling symptoms, and preventing joint damage. Now, one of the most important questions is, when do you use biologics? Biologic treatments are usually considered when first-line treatments such as methotrexate are not sufficient on their own. If inflammation remains active despite standard treatment, we may escalate therapy to include a biologic. The aim is always to bring the disease under control as early as possible. Let's talk about how biologics are given. Most biologic treatments are administered as injections under the skin. These are usually given either weekly, every 2 weeks, or sometimes monthly, depending on the specific medication. Some biologics are given as intravenous infusions in a hospital setting. For patients using injections, we provide training so that you can administer them safely at home. Many patients, understandably, are concerned about giving themselves injections, but most find that with a bit of guidance, it becomes straightforward and manageable. Question: are biologics safe? This is often the biggest concern. Biologics do affect the immune system, and because of that, there are a potential increased risk of infections. However, in carefully selected patients and with proper monitoring, these treatments are generally safe and very effective. Before starting biologic therapy, we carry out screening tests. This typically includes blood tests and screening for infections such as tuberculosis and hepatitis. This is important because biologics can reactivate certain infections if they are present. Once treatment starts, we continue to monitor regularly to ensure everything remains safe. Let's talk about the side effects. Most patients tolerate biologic treatments well. Common side effects can include mild reactions at the injection site, such as redness or discomfort. Some patients may experience headaches or mild fatigue. More serious side effects are less common but can include infections. This is why it's important to be aware of symptoms such as persistent fever, cough, or feeling unwell, and to seek medical advice if these occur. We provide clear guidance on when to pause treatment, for example, during a significant infection. Another common concern is whether biologics increase the risk of cancer. This is something patients often worry about. Current evidence suggests that for most patients, the risk is not significantly increased, particularly when these medications are used appropriately and monitored carefully. This is always something we discuss on an individual basis, taking into account your medical history and risk factors. Let's talk about how effective biologics are. For many patients, biologic treatments can be life-changing. They can significantly reduce pain, stiffness, and swelling, and improve overall quality of life. In some cases, they can bring the disease into remission. The goal of treatment is not just symptom relief, but long-term control of inflammation and prevention of joint damage. Now, what should you expect when starting a biologic? Once the decision is made, there is usually a process of approval and organization, particularly depending on the healthcare setting. Once treatment begins, you may start to notice improvement within a few weeks, although for some patients it may take a little longer. We monitor your progress closely, and one biologic does not work as expected, then often other options are available. Another important point is that biologic treatment is often used in combination with other medications such as methotrexate. This combination can improve effectiveness and reduce the likelihood of the body developing resistance to the treatment. Patients often ask how long they will need to stay on biologic therapy. This varies from person to person. In many cases, treatment is ongoing to maintain disease control. If the condition goes into sustained remission, we may consider adjusting treatment, but this is done carefully and under close supervision. Lifestyle also plays a role. While biologics are highly effective, maintaining general health is important. This includes staying active, maintaining a healthy weight, and keeping up to date with vaccinations. We usually recommend vaccinations such as the flu vaccine and COVID vaccine as appropriate to reduce infection risk. One of the key things to remember is that untreated inflammation itself carries significant risks. Persistent inflammation can lead to joint damage, reduced mobility, and long-term disability. So when we consider biologic treatment, we are weighing the risks of the medication against the risks of the disease. In many cases, controlling the disease effectively provides a significant overall benefit. To summarize, biologic injections are targeted treatments used to control inflammation in autoimmune diseases. They are typically used when standard treatments are not sufficient. They are given as injections or infusions, and although they do affect the immune system, they are generally safe when used appropriately and monitored carefully. They can be highly effective in improving symptoms, protecting joints, and improving quality of life. If you've been advised to start a biologic and you have concerns, it's important to have a clear discussion with your specialist. Understanding the treatment and what to expect can help you feel more confident and in control. If you found this video helpful, make sure to subscribe for more content on joint health and autoimmune disease. And if you're concerned about your symptoms or would like a specialist assessment, I see patients at Pure Rheumatology in London. Details are in the description below. Thank you for watching.